Cindy Purvis of Park City, Utah, was incensed when she received a letter in the mail, alerting her that her family's health insurance premium would skyrocket to $1,300 a month next year, a $500 increase. Purvis vented on social media, called her insurance company and eventually consulted with an expert who helps people sign up for health plans. She learned something counterintuitive: she would probably see a smaller increase if she bought the same kind of plan she currently has, but off the Affordable Care Act exchange. "We're in no man's land," said Purvis, 44, who makes too much money to qualify for federal assistance. "You know how it is with health insurance, it's so confusing. It becomes this game of which plan can I find that most of my doctors are on, and how much am I going to have to give up? Shopping for health insurance has always been confusing. But consumers looking for coverage at the start of open enrollment on November 1st face an especially baffling experience, and this year they will have less time and less help to reach a decision, because of funding cuts and rule changes. Insurance exchanges already battered by years of premium increases and insurer exits were thrown into further disarray by President Trump's decision earlier this month to end federal payments that insurers use to offset discounted health plans for lower-income Americans. Insurance companies have tried to make up the difference for those payments in ways that vary state to state, and insurer by insurer, and are often baffling to the ordinary consumer. In some states, such as Maryland and Utah, insurance companies are loading increases onto Silver on exchange plans only. Other states are spreading the increases more broadly. We call it an Alice in Wonderland year, because things are upside down. Things are very different, said Jason Stevenson, Education and Communications Director at the nonpartisan Utah Health Policy Project, which helps Utahns access health insurance. They're not following the normal laws of insurance physics. Silver plans, mid-level plans that aren't too expensive or too bare bones, will see big premium hikes in many states, as insurance companies try to compensate for the loss of federal subsidies that helped underwrite those plans. In some cases, that could make silver plans more expensive even than gold plans, which provide more generous coverage. People like the Purvises who pay full price for their insurance will likely be unable to avoid paying more for their plans, which could discourage people from signing up. Robert Lasevsky, a health policy consultant, said that insurance companies expect 20% of those who pay full price for their coverage to flee the market over the next year. One carrier described the situation to him in stark terms: "Our unsubsidized market is melting." Meanwhile, the lower-income Americans who would seem to be most at risk from Trump's decision to end the federal payments to insurers will largely be sheltered from paying more. They may even be able to pay very low premiums for minimal plans next year because of a second kind of federal subsidy, premium tax credits. But while $0 premiums may seem great, the plans typically carry giant deductibles that could catch people by surprise, and be far worse than their current coverage. And there won't be simple, universal rules of thumb, because the paradoxical effects will vary, state by state and insurer by insurer. For those who thought it was a story when, several years ago, there were startup difficulties with the website, that's nothing compared with what we're going to see, said M. Greg Blocky, a law professor at Georgetown University. How can there not be chaos? Some of those most caught up in the confusion will be people like the Purvises, who pay full freight for their insurance. About 6.7 million Americans buy plans that comply with the Affordable Care Act without subsidies, and many of them will confront situations where the mid-level plans could be more expensive than more generous ones. They also may need to pay attention to whether they're buying on the marketplace or off, because prices could vary. In Utah, where insurers made up the difference from losing cost-sharing reductions by increasing premiums for silver plans, people like the Purvises will need to comparison shop. Premiums for a silver plan sold on the exchange in Utah will increase by 55% on average, while a silver plan sold off exchange will increase by 23%, according to Tanji Northrup, the assistant insurance commissioner in the state. Everyone really does need to get out and shop around, Northrup said. We have that same message every year, but it's so crucial in Utah's market for 2018 plans. That's what Purvis plans to do. When November 1st comes, She will look for a better deal, whether it is the same kind of plan she has now off exchange or another one. Pervance and her husband realize they are in a good